Physical Therapy. I'm Dr. Catherine Price, and I'm a physical therapist. Today, I'm going to share with you acute rehab for IT band syndrome. Now, this is a problem that I have personally experienced and had a lot of difficulty with. And I'm going to share briefly my backstory to give an idea about how significant this problem can be, and it is a nemesis. So there's some folks that have this, you can end up having surgery, drugs, you can have different approaches, dry needling, and there are a number of interventions to help with this. And a lot of focus is on strengthening the hips and the butt muscle, and that is a great idea. But I do find that if you try that early on, it can actually pull onto the IT band attachment and be still problematic and painful. So a little bit about my backstory. So pain is inevitable, but you don't have to let it rule you. And it's great not to let pain rule you, but you do want to listen to it as a communicator. It's trying to tell you that there's a problem there. So how mine started was downhill running for 16 miles, and it didn't start really in the IT band knee, and sometimes you'll see, is this truly an IT band issue? So it didn't start out as an IT band issue, but I did start out with not paying attention to a trigger point in my hip. And then it developed a problem down that line. Now the outside of the knee is quite complicated. I'm going to show you a picture. So this is what the outside of the knee looks like. You can see that there's a lot of structures here, and so it can become problematic. Underneath your IT band, so there's two different branches. You've got an anterior branch that attaches to the outside of the kneecap, and then a posterior branch that is going to go down and attach to a place on the lower leg, the tibia, and that's called Gertie's tubercle. But it really is like a finger that splays out and attaches on that lower tibia and then in the knee. So you've got two different bands, and you've got a band that is tight when you extend or straighten the leg, and a band that tightens when you bend your knee. So the IT band is going to have a lot of structures underneath it, and so that repetitive movement can irritate those structures underneath. So there's what you call the arcuate complex, made up of the biceps femoris tendon, that's the hamstring that attaches to the fibular head, the lateral collateral ligament, which attaches to the fibular head, your popliteus tendon, which is a little bitty muscle in the backside of the knee, and you can also have the outside of the gastrocnemius attaching to that area. So you've got all these different muscle tendons attaching into one place, and then you've got this IT band right over top of it, kind of pushing down onto those structures. If you leave IT band syndrome and you don't address it and you're continuing on with that pain, what happens is those tissues that you just saw underneath, they can start to quote unquote rot. And so you can start to just wear like a rope rubbing against a rock and just fraying and tearing those. Well, I ignored a trigger point in my hip. It affected the whole lower chain. And I did end up running a marathon on the IT band syndrome. Well, that was not smart, as underneath I ended up going and tearing the LCL, the lateral collateral ligament. And now I have instability in my fibula, so I can move that bone back and forth because it has the ligament to stabilize was torn. So the tissue underneath did rot. And I'm going to share with you how I do manage this, and it's going to be a series of release, stretch, and strengthening, and I'm going to release certain muscles, stretch certain muscle groups, and then I'm going to strengthen certain muscle groups. A lot of IT band syndrome rehab is focused on strengthening the glutes and the hips, and yes, that is a great approach, but in the acute phases, it can actually irritate the IT band. So the IT band, if you think about it, it's the tendon of the gluteus maximus muscle. So your butt muscle, it's going to attach to the IT band. And so I think about the IT band being the tendon of the glute. So every time I push off or I contract my butt muscle, I'm pulling on that tendon. There's two muscles that attach to the IT band, your gluteus maximus and your tensor fascia lata from the front. Those are the two muscles, so that's important. These muscles are where we're going to release trigger points, and they are going to affect the pull on the IT band. So I want to release everything that's affecting the IT band, and then I'm going to stretch those muscles, and I'll show you how I like to do this. So the first release is what I call the butterfly glute release, and that's going to be releasing your glute max muscle. I'm going to use a 4 to 5 inch massage ball, place it on my buttocks, and I'm going to be onto my elbow, and I'm going to spend 2 minutes releasing my butt muscle. If I find an area that is tender or tense, I'm going to hold there. To actively release that, I can then lift that knee and bring it back down. So I am doing an active release of my glute max muscle. So I am just going through my entire buttocks region and searching for any tension and releasing that. And you want to go slowly. So you don't want to just roll up and down. You want to slowly go through these movements and find and effectively release them. Spending 2 minutes is the most effective time that I find when working on these areas. Now, like I say, I had an unchecked trigger point for a long time, so it took me a long time to address this. So you can spend longer time. The longer something's been there, the longer it's been a problem, the longer and the more time it takes to address that. So if that's the butterfly glute release, that glute max attaches to the IT band, that's where I'm going to start. Then so the IT band goes over from the iliac crest. Underneath that band is your glute medius muscle. I'm going to then just address the fascia of that upper part of the IT band. So if you find the outside of your bone on the hip and then the top of the crest, if I go in between there, I'm going to place a lacrosse ball. That's going to release the glute med, but the upper portion of the IT band. And my back leg is going to be on the floor, and then the leg that I am going to be releasing is going to be on the bottom. And this is the side where there's a problem with the IT band. I wanted to lie directly onto my side, and then I'm going to go through that running movement and by lifting my leg, bringing it up, and then straightening it back out. So I want to kind of go through that running movement. So I'm actively releasing the upper portion of the IT band, and the IT band is a big, thick fascia. If you think of it, it's kind of like a belt, and a belt's not really going to go anywhere. So I'm applying pressure and I'm just going through that movement. And I can just hold. And then I want to mobilize an inch forward and an inch back. So I'm then just going to move my hips forward and my hips back, searching for any tension or tenderness, and then holding right there and then putting the weight into that lacrosse ball by lifting the leg. And then I can then bring it through that movement, bringing it up and back down. So that's the second release. Then I'm going to go right around to the front, and I'm going to release my tensor fascia lata. To find the tensor fascia lata, I'm going to go to the front of the hip bone, and then that outer portion of where you feel the bone sticking out of your hip on the side. So I'll put my thumb here on the front of the hip bone. That's my ASIS, my anterior superior iliac spine. And then I'm going to put my pointer finger right in the middle there. So right in the middle, that's where my tensor fascia is again. So my ASIS right in the front of the hip, my trochanter on the side. Then I'm going to place my pointer finger right in the middle. That is where the lacrosse ball is going to go. So I'm going to place that there. I want to be directly onto my side, but then angled onto that area. So I'm going to have a little bit of an angle. My opposite foot's going to go in the front, and I'm going to apply pressure there with the lacrosse ball. I will then bend my knee and then let it rotate down and then back up to the ceiling and back down. So I am angled onto my side. So you're here, you find the front of the hip, the side, point your fingers in the middle, and then roll, angling down onto that. And I'm gonna bend my knee, rotate down, bring it back up. So that's the tensor fascia lata. I wanna spend 2 minutes here to release the tensor fascia lata. And it's important to release the tension in there as it is connected to the IT band. Okay, so we've had 3 releases so far. The glute max, the side where the iliac or the IT band is originating, and then on the tensor fascia. After I do that, I'm going to mobilize my IT band with a foam roller. And to do that, I am going to go onto the side, and most of the adhesions are between the vastus lateralis and the IT band. So I'm going to angle slightly downward. I will stack my legs. This can be really, really tender, and I'll investigate the IT band. So here I'm on the anterior portion of the IT band and investigating if there's any tenderness or tension along that line. If there is, I can hold there and then bend the knee and then straighten it to actively release the tension. And I will spend 2 minutes here. So that is the next mobilization that I'm going to do. After the IT band has been mobilized, I'm going to take a double lacrosse ball and I'm going to mobilize the peroneals, because the outer fascia of the peroneals is going to be a continuation of the IT band. So by mobilizing the peroneals, it's going to allow the tension of the connection over the outside of the knee to be lessened. And so I am going to take the double lacrosse ball and I'll go into a side plank onto my elbow, stacking my legs, and I'll just mobilize just along the outside of that fibula. And if there's any tension or tenderness there, I'll hold and then pump my foot up and down so that I'm getting that active release on the peroneals and I'm releasing the fascia along that line. So that's going to be my 5 releases: my glute max, the upper fascia of the IT band, the tensor fascia, the IT band, and the peroneals. After that, I want to go right into my stretches. So there is what you call rebound. I've got a 10-minute window before I'm going to rebound into some tightness. So I want to go right into my stretches before I have that rebound. And there's 2 stretches that I will focus on. The tensor fascia. So I want to stretch the tensor fascia. I'll do that. The tensor fascia I want to stretch is going to be right on the front side here. So we'll go into bringing that leg behind me, reaching, and then pulling the foot towards my buttocks. When I do that, I should feel the stretch right through that tensor fascia. This is going to be a rectus femoris stretch, but you should also get it all the way up where you have released the tensor fascia. And I will just hold this stretch 3 times, 1 minute. My other stretch is going to be a hip stretch, and this is going to address the glutes and the rotation and the hip. So I'm going to do a fire log stretch or stack my lower leg, and I'm going to try to make a position so that the lower legs are stacked. If your hips are really tight, you can end up being like this, and it's hard to get that stretch, but that is where I'm going to stretch, and I should feel the stretch through the outside of the hips and outside of the leg, and I'll hold that right there. And then after doing that for a minute, switching, because it does feel different with one leg stacked on top of the other. And so I will also switch and stack the legs this way and alternate back and forth till I've done about 6 minutes of stretching, 3 times 1 minute, which with each leg stacked differently and just working to where I can stack those. Those are my 2 stretches. Then I'm going to do 4 sets of 25 of adductor strengthening. So when you're running or walking, hiking, you're going to be using that IT band as a stabilizer. I want to focus on giving that a rest and then using the inner thigh to stabilize. To do that, then I want to really challenge my adductor muscles. I can keep my legs straight, but that does strain the inside of the knee. So you can bend your knee, rest it on a chair, and then I'm going to use my top leg to lift my body weight up, bring it right back down. I'm going to do 25 of these. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. The other thing that I can do to strengthen the inner thigh is take a soccer ball. You can use a block. You can use anything that's going to give you a little bit of resistance. And I'm just going to, in a tall kneel position, I'm going to squeeze my legs in just as hard as I can so that I'm really activating the inner thigh muscle, and I'll hold that there for a minute. So I want to extend my hips, and I can even lean back and forward so that I am continuing to hold that isometric squeeze while I am moving my spine and pelvis. So I am holding my hips with the adductors. So 30 seconds. And I want to focus on just making sure that I'm not letting go of the inner thigh and I'm keeping a nice long contraction. When I'm doing this, I should feel the outside somewhat relaxed. You want to relax the buttocks muscle and work the inner thigh. And after I do that for a minute, I can stand. And I can do the same thing in standing. I'm going to squeeze in just as hard as I can. And I'm just going to slowly extend my spine, my pelvis, and also bring it forward. So I'm just moving my low back, getting that lumbopelvic rhythm, but I'm really focusing on the squeeze and stabilizing the pelvis with my adductors. And again, in this position, you want to focus on trying to keep the buttocks relaxed, and you want to keep the tension on the outside of the legs low, and you want all the stabilization and the work to be on the inner thigh here. And so this is for a minute. So I've got a good 2 minutes of activation of those adductors after strengthening them with body weight. So that is the completion of the acute rehab for the IT band. It is 5 releases: the tensor fascia, the upper portion of the IT band, your glute max, the IT band itself, releasing those adhesions, the peroneals on the lower part of the leg, and then stretching the glutes and the tensor fascia, and then strengthening the inner thigh. That's a great place to start. So when you finish, you should be able to bend and straighten your knee, have no pain, and then your chest to see if you can jump and have no pain. You can go up and down stairs or do whatever movement that was giving you pain to see if it is better. It should be better after going through that. If not, you want to go back to the drawing board. So I hope you have a great and blessed day. Thank you.